Hello, everyone. Greetings of the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is a very common on your skin or nails. Fungal infections or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Gayathri Rajesh, live from Chennai, to enlighten us on the topic of fungal infection. Dr. Gayathri Rajesh is MBBS, DDVL dermatologist. She is an ex-faculty from Sri Ramachandra Medical University at present, dermatologist at Apollo Group of Hospitals. She has a clinic at Pet and Old Washington Pet. The clinic name is Dr. Gayatri's Skin and Sugar Clinic. I'm extremely sorry for the trouble. But again, ma'am, we would like to welcome you to today's
Thank you.
platform.
Thank you very much for your kind words and the nice introduction. Thank you.
Ma'am, the first question for you would be, what is fungal infection?
So, fungal infection is when fungus, which is, it can be a superficial or deep fungal type. So, that which enters your body and causes the kind of rash which occurs in many people. So, that is a superficial fungal infection which we see on the skin. And that is basically called as dermatophytosis. When it occurs in the nails, it usually is called as the dermatophytosis of the nail. And if it's usually some common organisms, so that is called as certain common organisms, which is called as onychomycosis of the nail. And on the skin, you have many kind of species. So they can be zoophilic, they can be anthropophilic, they can be, so many types of species are there. And you have many like classification of organisms, but they're group of organisms which have like some are of yeast type, some are spores, some are, so it has a spaghetti and meatball appearance. Some have they have branching hyphae. So there are many kinds of organisms, but the most common type of superficial fungal infection which we commonly encounter and which I'm going to talk about today is the tinea infection, which is caused by superficial dermatophytes. Okay, so there can be many types of organisms, but just for simple understanding, they are superficial dermatophytosis, and they simply called as tinea corporis, which is in the body. If it is only in the face, it is called as tinea faciae. If it's only in the hair, scalp, it is called as tinea capitis. If it's only in the nails, it is called as tinea unguio. If it's in the genital area, it is called as tinea gluteae, and yeah, so and so forth. So this is the common thing which we will talk about. Yes.
Right. So, doctor, does fungal infection in different area have different causes behind it?
No, so that's what the point is. The point is that you have epidermophyton, you have eflocosum, then you have mentagrophytes, then you have many types of tinea infections. Okay, so the most common is mentagrophytes and rubrum, which are the most common kind of organisms from the tinea group of the main classification. So they can cause fungus anywhere in the body. So it doesn't mean that okay, there's a fungus in the axilla which is called as tinea axillae is different from tinea corporis, which is different from tinea gluteae. It's all the same, but it can cause infection anywhere. The most common is trichophyton mentagrophyte as well as trichophyton rubrum.
Right. Uh, Moving ahead, doctor, tell us a little bit more about the nail fungus which you mentioned, because we personally have seen it's very stubborn and it becomes very difficult to cure such patients who are suffering from fungal infection in the nail area. So, normally, how long does it take and what are treatments available?
So nail fungus can be caused by a dermatophyte, which is dermatophyte superficial fungus, as it also can be caused by deep fungal organisms. So, as such, it is called as tinea unguium if it's a superficial nail infection, or in simple terms, it is called as onychomycosis if the organisms are non-dermatophytes. So, it can be candida as well. So, you see this, you see the white. So, in the nail, you'll start seeing in the basically in the proximal a matrix, it will start as a white coat, so there'll be a white discoloration, so that is fungus. If it's green color, then it's a bacterial infection. So white denotes fungus, and it usually occurs most commonly in patients who are a diabetics, b people who are chronically having any nail fold infection. So people who are constantly, for a longer time, people who have been washing vessels, people who have been, washing clothes, and so cumulative dermatitis, where you have the nail fold infection, they have a common affinity of having the fungal infection of the nail. So first is diabetes, second is people who are common household workers or people who are constantly in water, so where you can get fungus very common. And usually if you have fungus of one nail, you have fungus of a lot of other nails as well. So what can be done is, see, if usually we do a nail, we'll chip a part of the nail and send it to the lab and see what kind of organism is there. The medication goes like, for see, for it's a dictum that if we start with any oral medication, so we give what is called as a pulse dosage. So pulse dosage is we give oral itraconazole or oral terbinafine for the first 10 days, leave a gap of 1 month and give it for another 10 days. And like this, we have to give it for about at least 2 months for the fingernails and 3 months for the toenails, because it takes that much time for the medicine to go get accumulated and start working in these particular areas of the body, as opposed to the normal parts of the body which are okay with about 6 to 8 weeks of treatment. So this stubborn thing takes about at least 2 months for the fingernails and 3 months for the toenails. So we give pulse doses of medicines for first 10 days and leave a gap of a month and again 10 days. We give something which is called as topical drops also. And nowadays we have something which is called as a nail lacquer. Nail lacquer is something like a nail polish, which is basically an antifungal agent, which we apply twice a week for about 2 months, and which basically prevents the growth of fungus in the other nails as well.
Right. So, for all the people who are already suffering from the same kind of fungal infection which we are talking about, um, is there any hope? Because most of them I have met with, they have lost hope and they have almost accepted the fact that this is not going to get cured. So, ma'am, please tell us that is it possible that the fungal infection is cured completely in the nail area specifically?
See, fungal infection in the body. Okay, so first we'll talk about the body. The body takes
Right.
about 8 weeks. So what happens is when the fungus basically stays onto the body, all of us take bath, our immunity is good, so the fungus doesn't really affect us. The skin is a superb agent against fungus and automatically it removes. But sometimes what happens is when our when our immunity goes down, okay, so when
Mm.
the fungus starts getting into the, and fungus doesn't go beyond a certain layer. When we're talking about superficial infections, so you're talking about
Right.
superficial dermatophytosis, it doesn't go beyond an area which is called as an Adamson's fringe, where it doesn't go beyond a certain area. Beyond the hair level, it doesn't go. So it just is at the level of the hair, but it starts spreading to larger areas of the body. And you have to take medications for it, but you have to take medications at the right dosage and for the right duration of time. So what happens is when people take the medicine, say they've got fungus as opposed on the neck and over the chest, they take it for about 2 weeks, the fungus goes and they're very happy, oh, it's like magic, it's gone. But they don't realize that
Mm.
after 2 months, when the old skin kind of wears off and the new skin comes, as the process of the normal skin exfoliation
Mm-hmm.
and rejuvenation occurs, the newer the fungus comes back. So they feel that the fungus never goes away from the body. It's actually
Right.
that you have to continue the treatment whether or not for 8 weeks. Apply the creams which are given to you twice daily. Take the medication given by your dermatologist correctly for 8 weeks. Apply powders. You don't use anybody else's soap. Use your own towel. Make sure that you use Indian toilets versus Western toilets, because the transmission rate at Western toilets is very, very fast. So make sure that if someone in the family has got, you also treatment for it, because it's very easily transmissible by it's through fomites. So any sort of viable agent, like even we go to theaters, when we go on public transports, we go to public toilets, so you can get the infection transmitted from there as well. Okay, so it's transmittable through these areas as well. So we have to be very, very careful that we have to prevent it in a way that use the soap, you use your treatment given by a doctor for 8 weeks. That's the dictum. And the dosages. Now, for nail fungus, what happens is you have to take the treatment for 2 to 3 months. Don't give up for 3 months. Okay. If your nail is completely having a lot of fungus, then the doctor might do certain procedures if they feel like, see, so it depends. Like if I feel that the nail is completely gone and the entire nail is totally damaged, and nothing much can be done, and it's also having an ingrown toenail, then I could partially avulse doing chemical cautery, as well as doing a procedure doing partial nail avulsion, as well as if the nail is completely totally gone in terms of just not the infection, then we will do a nail avulsion. But that is only if you have ingrown toenail along with the nail fungus and the nail is totally completely damaged and dystrophic. But if the treatment usually works well, if you take it for over a long period of time, see, for nail infections it is definitely 3 months of the
Right.
yeah, either it's toe or whether it's the finger. Yeah.
Right. Doctor, tell us about the scalp infection also. You mentioned that fungus can
So
also occur
scalp
in the scalp.
fungus is scalp fungus is some people, like, don't really come to know about it, because you think that certain areas of your scalp are itchy. When we
Mm,
actually see it on the scope, when we, that there are round areas which have a lot of fungus and we need to get treated. So that is called as tinea capitis. Many people
mm,
actually also get this kind of infection where they have patches, they have patchy hair loss, and it is in black color. So they're called as black dot type of fungus as well, which is there. But they are different kinds of patches, which is again confused with loss of hair, which is alopecia areata. That is totally different. Now, when you're only talking about fungus of the scalp, you need to take the oral antifungus, as well as there are certain drops which you apply, and you have certain shampoos which have very good quality of ketoconazole, coal tar, salicylic acid, which are help to remove the scales faster and the fungus faster. But you've got to use the same kind of treatment for at least 8 weeks of time.
right. So, how does the initial stage look like here? Is it dandruff or is it like scaly dandruff?
See, dandruff is also, they say it's not a fungal infection. Dandruff is a more inflammatory process. But they
Hmm,
say that all the fungus also kind of starts having an effect on the, whenever there is colonization of fungus, even in the dandruff. So we give an antifungal course even for people who have dandruff. Okay, but dandruff is just oil. It's not a fungal
hmm,
infection. Fungal
right.
infection is when we remove the hair or tonsil hair completely. You'll see nice
Hmm,
round patches around your scalp. Okay. And when you take the hair shaft and see it under the microscope, you can see a nice branched hyphae. Or you can see spores and meal. So it depends on the kind of organism which is there. But you can see that, you can see the spores, you can see the branched hyphae. So that is actual tinea capitis, and that requires treatment. The best treatment for that is griseofulmin, and most commonly, but that affects children more than
right,
adults.
right.
Adults usually don't get a fungal infection of the scalp. They usually
Mhm.
have dandruff or severe kinds of dandruff.
Right. Doctor, you have already mentioned that it is contagious. So one needs to take care of themselves if somebody around them is already suffering from the same. So what if
So very,
someone from our
no,
family,
yeah, so that's what I
right?
keep telling my patients. See, from the place which I come, where I work in North Chennai, which is a harbor of fungal infections, because people there use one single toilet for the entire building. Okay, so it's a very crowded place, and they have like four families using one or two particular toilets, which is common. Okay, so and so the nidus is very, very common that people get. So to prevent this, if anybody has got in the family, please tell it outside and go to the dermatologist and get it treated, most importantly. And do not use anybody else's towel, anybody else's dresses, anybody else's combs, anybody else's towels, most importantly, because towels are something which I think everybody uses in the family. At least your bed sheets and everything is specifically done. And soaps, very important. What we do is, most of the times, okay, most we'll keep it very, but if you have a common bathroom, using someone else's soap is very common, and I'm saying it very practically. So you
Mm-hmm.
should be very particular that you're not using anybody else's things at all, because that's how it starts spreading. So what happens is, one person is got, then the other person is got, then the other person is got, and this becomes like our entire this thing altogether.
Right, right. Doctor, I can understand the precautions which you are talking about, but the major issue comes when we tend to wash our clothes. We always tend to wash the clothes together. Everybody's clothes have been washed together in the same washing machine. So, can these washing clothes
Yeah,
together
that
also
that's
somehow
another point which I was going to tell you, and there was some glitch in between. That do not tell them to use the same bucket to keep the. What they do is, they'll throw the old clothes onto the bucket, and not
Hmm,
everybody washes clothes every day. Let's be very practical.
right,
Alternate days, even if
right,
someone is putting it in the washing machine or washing, the clothes are stumped and stacked together in one particular place. That can
hmm,
cause. So we have certain antifungal washing drops also, but that is not available everywhere, and everybody cannot afford it. So what you should do is, these people should keep their clothes separate and wash it separately only.
right, right. Also, tell us, doctor, is sun drying the clothes important? Because we are still facing monsoon in a lot of places. There has been waterlogging. In fact, still here it has been raining now, so it's very hard for the clothes to get dry in the sun. Also, because of lack of space, we hardly find any space to dry our clothes nowadays. So, is it important to sun dry the clothes? If somebody is not able to, what are the alternatives for that?
No, no. Sun drying is important only, but I would say that you should iron your clothes. Yeah, the ironing part is very important, because that amount of heat is required not just for fungus, for any kind of any organism like simicosis, or any organism. To see, earlier times, why they would insist in schools that you should have your clothes ironed, is not because you should have a neat look. It's because most of the organisms basically get killed when you iron them. Sun, I don't know how much that heat is helpful. Of course, air drying and the heat is important. It is important to do that, but I think you should get your clothes ironed. It's very important, or you
Right.
should iron them at home.
Right. Doctor, amongst all the fungal infections which we discussed about today, what is the most serious kind of fungal infection which we
Just
normally get
one
to see?
second. One second. No? I'm getting out of charge. That's why. One second.
Right, right, absolutely, no problem, doctor.
Just one second. Yeah. Can you see me? Yeah.
Yes, we
Sorry.
can.
Sorry.
We,
Sorry.
we
Yeah.
can. We can see it. It's fine, doctor.
Can you hear?
Yes.
Yeah. Can
So,
you tell me the question again?
so the question was, amongst all the fungal infection about which we discussed today, what is the most serious kind of fungal infection which you get to
So
see?
the most serious would be something which is the deep fungal infections, not the superficial fungal infections. Superficial is not at all something to worry about, because it doesn't go beyond a certain level of the hair root as well. So it is not through blood that it's contagious. So it doesn't reach the blood level only in the first case. The
Right.
ones which are supposed to be very notorious are the ones which affect the system. That affects the
Hmm.
lungs, which affects your rhinocerebral area. So those are deep fungal infections. That is completely different. That is those
Right.
fungal infections which are beyond, which go to the blood level, which are basically affecting your other organs. Those are very, very notorious, not the superficial ones that you see on the skin, on the rash ones. Those are not at all, so not something to worry about. Only thing is, that it spreads and it keeps causing a lot of itching, and it's seen all over the body, so people feel a
Hmm.
little stigmatic about it. But other than that, that is nothing dangerous.
Right. So when do we get to see such scenario? If somebody is delaying their symptoms?
Yeah, so first symptom will be itching. They'll say that they have a lot of itching. They wouldn't, most common is in the genital area in the buttocks, where people don't come to know because they don't get to see that area. At least in the front areas, where your genitals, people see. But in the back, people tend to miss because they only feel very itchy, but nothing else. And some and infection at the back. But other areas of the body, it's quite easy to pick up.
Right. Doctor, also tell us about the pregnant women. Is it safe for them to take the antifungals which we normally give to patients?
Yeah, so pregnant women, this is very common because we tend to sweat a lot. Like whenever pregnant, during pregnancy, you tend to sweat a lot. Taking bath again, I, as much as I have seen many ladies skip baths. Okay, they, especially during the last trimesters, they do scrub baths at home itself, and that's completely not going to take any sort of infection out unless you really do it properly. But antifungals is only topical when you're in the third trimester, that is your last trimester, where all the baby's organs, everything is completely formed. Then you can take oral medications if necessary, and if it's a large body surface area. Otherwise, I would say that no need to take any oral tablet. There's this tablet called as terbinafine, which is safer in the third trimester.
Right. Doctor, we
Creams you
know
can
that.
apply.
Right. We know the medications for fungal infections. We know what to take if we are not well. If we are feeling sick, we know the paracetamol is something which we normally take. Or we also know the antibiotics nowadays, which we need to take. So, what if somebody is self treating themselves? How harmful can it be for people who are suffering from fungal infections?
So fungal infections, what happens is it's okay to take a course of fluconazole, because that is
Mhm.
something which people take even if they have white discharge. And moniliasis is something which everybody kind of suffers from as well, especially during the reproductive age group.
Mhm.
Fluconazole, which comes in 100, 150, 250, 150, 200, 400 mg once a week
Mhm.
for at least 3 weeks is advisable. It's okay. Taking the topical creams is also okay, but do not take combination creams. What happens is when they mix it with steroid, which is most commonly available for any fungal infection, and every pharmacist gives it,
Right.
because it is cheaper than the original antifungal. So an original antifungal, say, is around 350, 400 rupees. A combination cream comes in 200. So what patients will say, I'll take this cream, and they'll feel very good because steroid will initially keep you off the itch, keep you off the burning sensation very fast. And people get used to it and they apply it, and when they come to us, the fungus is full blown, the skin is tearing apart because of the atrophy the steroid causes, and all sorts of superficial other bacterial infections they'll come with super added. So do not use a combination cream even if it is easily available. Please, best is to consult your dermatologist. You consult once and they're going to call you after a month only. So why this thing of not going to a doctor? See, it is
Right.
not that it's just going to be of a, see, just taking one tablet is not relieving you of your
Mhm.
symptoms. Itching, you take a tablet, okay. You're taking cetrizin, everybody knows that. That is okay. But do not apply combination creams. If you want to apply plain candid, plain ceritonazole, plain antifungal creams. If you ask the pharmacist, they'll give you, at least that is safer than using a combination cream. And please, after 2 or 3 days, consult your doctor. Something like soaps, you can use it. You can use a soap very, like, at least without the thing, you can use a soap. You can use powders. Powders are very good because they're sweat absorbing, and also that they prevent the spread of the fungus to a certain extent, because they also have anti-inflammatory properties, and so that you don't feel so itchy, and it's your skin becomes a little smooth. One more thing is any antifungal can cause a lot of dryness, so apply a good amount of moisturizer as well.
Right. Doctor, you mentioned about fluconazole. Also, we know about the steroidal creams. People has been using them on themselves, or they'll get it from the chemist. And somehow such medications are not responding anymore. Why is it? Because they are becoming resistant nowadays. Can you please elaborate it for us a little?
See, fungal resistance is it'll be there even if you are yourself taking it for a very long time. But the only thing is in using a combination. So you use like uh, itraconazole and terbinafine alternate. That's what I do. Fluconazole
Mm,
for a superficial infection doesn't really work that much at the first go. It is more of a maintenance based tab medication. So
right,
itraconazole, which is a more specific than fluconazole, and along with the terbinafine. Okay, so one is a term, bacteria like a fungistatic, one is fungicidal. So terbinafine is fungicidal and itraconazole fungistatic, and that works. The combination kind of works better. In creams also, I give like two different types of creams. So apply twice daily and 2 centimeters beyond the lesion area. So these things matter. See, resistance is you have to give a combination. So immunotherapy alone will not work.
right. And what if somebody is suffering from fungal infection on the face? What kind of skincare should one follow?
The face usually doesn't affect the face. And if it affects the
Mm,
face, usually it is called as tinea barbae, which affects the hair follicles. Okay, so
right.
they should not, if so, in men or even in
Mm,
women, I mean, people who wax or people who even shave, even in women, people of hirsutism and all. Do not reverse
right.
shave. Shave only in one direction, first of all.
Mhm.
Don't use anyone else's shaver. Don't use anyone else's soap. Use an antibiotic cream once you always shave. And please take the tablets because face is something which you shouldn't get. If you've got it, means your resistance to the fungus is absolutely zero to nil. Your immunity is absolutely nil par. You have to take
Right,
the medicines even for 2 more weeks extra.
right, right. So is it safe to take such antibiotics for a long term?
Antifungals. Antifungals for a long term is
Antifungals.
safe. But we have to monitor their liver function tests. That's the only thing probably we should monitor. And but we should also keep in check if they are taking any because usually itraconazole is not usually given with statins. Patients who are taking statins for their high cholesterol, it causes a condition which is called as rapid rhabdomyolysis. So that is not usually given. At least I don't give. Though itraconazole is a broad spectrum antifungal, but still I don't usually give. But it depends on people because they say it's dose related. The most
Mhm.
safest medicine to give is terbinafine in most of the conditions. So if the LFT is really deranged, I think terbinafine is a better drug of choice.
Right. So does the infection look a little different for the people who are suffering from diabetes or say thyroid?
No, thyroid, not thyroid. People who have diabetes or people who have an immunosuppressed state, like they have other
Mm,
infections, or if they're suffering from tuberculosis, or they're suffering from HIV, or they're suffering from any other infection, the lesions are more extensive, they're more larger, they're resistant to treatment. So this is the variety you'll get, not more than that. The lesions will be larger. They'll be more
right,
like spread all over, and the treatment will take 2 3 weeks more than a routine person's.
right. Doctor, I can see a few questions coming up from the viewers. I'll quickly take few of the questions. The first question comes from Pooja, who asks, can fungal infection affect vision?
Not at all. Meaning fungal infection, as in I meant to say superficial. We're only talking about skin level. If it's a
Right.
fungus which is systemic,
Mm,
okay, something which which is going to affect the rhinocerebral area, which is affecting the lungs, yeah, then it can affect the vision. Yes.
right. The next question, doctor, comes from
So,
Amit,
like
who asks, ma'am.
these fungal infections, like mucormycosis, which came into a big thing during the COVID, that can affect.
Mm,
Yes, you have other defungal infections which can affect uh, other systems of your body. Okay, but the superficial infections, like if you say tinea faciae or the fungus which is occurring on the skin, no, that doesn't affect vision for sure.
Right. The next question, doctor, comes from Amit, who asks, "Ma'am, how can air quality affect fungal infections?"
What quality?
Air quality, air.
No, no, it doesn't affect. It's not through nasopharyngeal. That's what I said. So this is all we're talking about superficial infections. It's not through nasopharyngeal. But deep fungal infections, yes, can. They have a nasopharyngeal route, but not superficial. Superficial finger fungus is only through skin contact.
Right. The next question comes from Anjali, who asks, "What precautions should one take while gardening?"
Gardening is, yeah, so thorn pricks or anything of that sort, you should just wear your boots, wear your gloves, and make sure that you're not hit nothing in particular. Do everything you feel like, nothing in particular. If you want, wear a mask, that's all. But again, then again, it's the infection we are talking about is doesn't get it doesn't come through those things at all.
So, doctor, can fungal infection spread through pets as well if somebody is having pets at home?
Yeah, yeah, because there are some zoophilic species. Yes, it can.
Right. I
And
will take
through
one last.
through soil as well, but not that evident in terms of uh, in many studies which have come. But through soil, yes. Through pets more. Through people even more.
Right. Right. The last question, doctor, comes from Rajesh, who asks, "How can fungal infection affect wound healing?"
Not much, ma'am. Nothing much to do with wound healing, as in this fungus cannot form wounds, first of all. And if there
Mhm.
is already a wound existing, this has nothing much to do with the healing or with the worsening of the wound.
Right.
Just that
Well, it was
it's a completely different thing altogether. Yeah.
right, right. Ma'am, it was a very, very informative session today with you.
Thank you.
Before we take a leave, any take-home message for our viewers who has watched us so far?
Yeah. See, I this is a very rampant infection I see, and I make it very very clear because I see a lot of cases in the area where I work. Huge round patches of fungus, okay, and with central clearing and large surface area affected. There'll be like families coming and showing that the entire area being affected. So one is, please use good antifungal powders if you catch the infection. Second is, don't use use Indian toilets. I honestly think the more westernized we get, the more chances of any infection occurring. Okay, Indian toilets are much safer in that way. Third is, do not use anyone else's soap, anyone else's towel, anyone else's clothing, linen, anything of that sort. If you have the infection or anyone else has the infection at home, wash the clothes separately. Please consult your doctor and take the course properly. Don't take the course for 3 weeks thinking, oh, it's gone, because it takes 8 weeks for the course of the fungus to completely leave your body. It's not a very dangerous infection, the superficial fungus I meant, but let it not spread so much so that it affects your day to day activities.
Right. Well, that was the expert advice for today, and that was Dr. Gayatri Rajesh for us. Thank you so much, Doctor, for your valuable time. It has been
Thank you.
quite an
Thank you.
informative
Pleasure.
session for our viewers today, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you very much. Thank you. Thank you.